Welcome to Psychologist Talks. Today's going to be episode 2 in a series about dependent personality disorder. Today's goal is talking about subtypes. There's going to be 2 of them, but inside those 2, we're going to actually talk a little bit about some differentials with other personality disorders, and then we're also going to talk a little bit about gender. Not sure if I'm going to interweave gender or if I'll leave gender for the end, but while I've had separate episodes on gender, in this particular case, it makes sense just to wrap it all together. So we'll see how that goes. Now, the 2 subtypes are passive-aggressive subtype and a counterdependent subtype. And just telescoping out about these 2 real briefly before we dive into them, it's kind of interesting to me because often when I think about subtypes, it's kind of like a fork or, branches off of out of a singular road. Like here's a construct, here's a bunch of subtypes. Whereas with dependency, it's kind of interesting because the passive-aggressive subtype, you'll hear me talk more through the lens of like an extreme version of something that already exists in the prototypical type, whereas counterdependent is like the exact opposite. The underlying issues are still the same, but the expression is absolutely the opposite of your typical prototypical dependency. So just kind of bear that in mind, that we're not talking about like these subtle kind of related subtypes. These are one's kind of subtly different and the other is a night and day difference. So we'll get into that. Let's start though with passive-aggressive subtype, and I'll start first with how passive-aggressivity, is that a word? How passive-aggressive behavior is actually quite normal in your prototypical dependent personality disorder, but it exists to varying degrees. And at some point, we draw a line in the sand and would suggest a subtype, with, again, a caveat coming down the road of differential from other conditions. So passive-aggressive behavior is not atypical in dependent personality disorder. Why? Well, as you heard in the key elements, a lot of this is about passivity and submissiveness, and in doing so, a submission of self in the service of others. To secure relationships and to stay secure in those relationships, they have to make sure the other person's needs are met at all costs. Now, this does not mean an absolute neglect or failure to realize that they have their own needs and those needs are not being met. It's just they often have a really hard time articulating those needs, never mind leaning into asking for and practicing those needs. And so even the most severe dependency I can think of will still have a little bit of anger and frustration rolling around in there about their needs not getting met. They're not like blissfully unaware that their needs aren't getting met and that there's unsatisfactory parts of the relationship. It's just that anger and frustration and thereby aggression is seen as so dangerous that they cannot encounter it. But you better believe as they encounter it, what do they end up doing? Oh, they're not direct with it. I mean, every once in a while you'll get them brave and they'll have like a miniature blow up, but more often than not, their blow-ups are usually when they're really entitled to position. It's just on kind of one argument, about child rearing, or, some financial decision or something that they can be really firm on, then it disappears again. Sure, they can be direct, but more often than not, they're going to be passive-aggressive about it. Now, prototypical dependent personality disorder, they will be quick to gather that back up and be like, never mind, whoops, nope, psych, never mind, no, I don't know what you're talking about, no, I'm good, everything's good again. They're going to act like the anger and aggression is all good real quick, or they will actually work to undo whatever aggression came out, which is antithetical to their growth. They actually need and benefit from leaning into the aggression more and more. They just don't know how to do it healthily, and hence not at all. Passive aggressiveness may be periodic outbursts at most. Now, a quick caveat to this, based on age as well as generation. I will say in my work, I tend to see passive aggressive behavior more as people have aged through the condition. You think about people in their 40s, 50s, and 60s, they've had a lot of relational experiences, usually over those span of years, because they tend to be chronically in relationships. Dependent personalities do not operate well alone, so they will find their way into any relationship they can, even not so good ones, if not especially, unfortunately, not so good ones. And so when they're reaching age 40, 50, 60, they've been wronged a lot of times. And while the psychological defenses that maintain dependent personality disorder are very strong, they are not so strong as to fully combat the repeated reality that occurs to them over decades of time. eventually they start realizing, these relationships aren't turning out well, and I am lost in the process. My needs are lost in the process. I am hurt in the process. And so anger and aggression tends to be more prevalent, appropriate, good aggression. I know aggression has a bad name, but aggression serves a purpose. And so they tend to be a little bit more passive aggressive, which is cool. I like it. That's them moving towards growth, which we'll talk about a little bit here later with the passive aggressive subtype. Generationally, I do wonder, and this is actually where gender is infused as well, that as the younger generation is socialized less along gender norms, because dependent personality is highly gendered construct, because dependency is associated with more feminine qualities, even though it can be expressed by more masculine creatures, men as well. But it's modulated by this quite a bit. So, with men, boys, masculinity, there's more allowances for aggression and anger. And with that, you tend to get greater expressions of anger, and thereby, I would posit a greater propensity or tendency towards passive-aggressive behaviors, if not slightly more verbally aggressive behaviors within relationships. There has been some research out there that says domestic violence is a thing that can occur for men with dependent personality disorder. But to me, to get to that level, that's a very severe level. I'm wondering about the influence of other personality components than just dependency. Dependency would not necessarily allow for that, not in my kind of understanding of it. And so I think we're talking about something else when we get that far down the beaten path. But I would very much bargain that there are more allowances for men, more allowances under masculinity. But generationally, as we kind of give more permission for the expression of aggression, whether through sports or emotional expression for femininity and thereby women, I wonder if you're going to see a little bit more passive-aggressive presentations of dependent personality disorder because of these allowances. Will that be true? Is gender socialization and sort of generational socialization powerful enough to burst through the more prototypical walls of dependent personality disorder? I do not know. And I have to kind of keep observing in my profession and see how this shakes out, particularly as the younger generation is starting to hit the adult population, which is when I tend to see them. So I'm thinking the next 10 years, I think, personally, I'll have seen more, and we'll see what the profession does as far as research goes. So all this being said, I haven't actually gotten to true blue passive-aggressive subtype. So you'll hear me. I'm kind of incrementally working my way up as the degree of aggression is expressed, and at some line in the sand, we just draw. Some line that we draw in the sand says this passive-aggressive behavior is so pervasive that it should be labeled a subtype. And indeed, when we talk about the subtype, we're not talking about this kind of subtle passive aggressiveness. We're talking overt, frequent passive aggressiveness. The example that might be helpful is essentially if you have someone with more prototypical dependent personality disorder coming in for treatment, they might express passive aggressive thoughts and reactions and feelings to you. But you would be wise to be suspicious as a provider of them actually doing that outside the therapeutic room. Whereas a passive-aggressive subtype, you better believe they're doing it outside the room as well. And there's, to me, it's kind of two sides to the same coin. It's very tragic because that passive-aggressive behavior becomes a self-fulfilling prophecy. Think about the underlying tendency. There is this deep need to have a powerful other person that they're linked to, that they feel safe with, and they're terrified of losing, but they're so kind of frustrated by the lack of their needs being met. The passive aggressiveness is coming across all the time, which basically encourages rejection. Productive. You're allowed to have conflict in relationships, but it is counterproductive to have that conflict only through passive aggressiveness. The individual in the relationship is just I feel like you're always mad at me, and I confront you about it. This is a healthy partner. Let me say, this would be a healthy partner trying to do this. Is you're always mad at me, and I keep trying to address it, and you keep telling me nothing's wrong and everything's fine, but then you just make these comments that make it feel like things aren't fine, or I am messing up, or I'm hurting you in some way, and they just get frustrated and leave, and then that reinforces see, I can't, I'm rejection is right around the corner and I can't express any anger because if the minute I do, it's going to get me in trouble. Ignoring that under the passive aggressive subtype, they've been wearing at the relationship because of the passive aggressiveness this whole time, which certainly secured the outcome. A different way of saying this that, if it helps conceptually, is like the countertransference is also a little bit different with this subtype, in that, like, as a provider or even family members, there tends to be a lot more sympathy towards your prototypical dependency because they're so pleasant and agreeable. Whereas the countertransference with passive aggressive subtypes is rough around the edges and increasing dislike and frustration way quicker, because that passive aggressiveness is right there. I mean, they will say some pretty toxic, virulent things about their partners or their family members or friends or whoever it is letting them down. And they're just like, they can't be pleased. It's just this endless frustration where you're like, well, why are you still ingratiating yourself? Why are you still in this relationship? Why are you, you're saying you're afraid. You keep doing these things that are sabotaging the relationship. They're far more self-defeating in their behavior than a dependent personality is. Dependent personalities are excellent at trying to maintain the peace at all costs. Passive-aggressive subtypes, they do not do as good of a job. And so that's another one of those differences. Now, my final remark on the passive-aggressive subtype for dependent personality disorder is overlap with other personality disorders. And this one confuses me. I'm not 100% sure I know what to do with it. But if you look at my episode on subtypes for borderline personality disorder, I'm pretty sure in there I mentioned a more internalizing presentation of borderline personality disorder, where borderline personality disorder has a lot of similar insecurities, but there's a lot more impulsivity and a lot more mood lability. But research has shown that there are absolutely more externalizing kind of explosive versions, but there can also be more reserved versions of borderline personality disorder. Well, what do you think aggression and hostility in a more reserved manner might look like? It might be more passive-aggressive in nature, very infrequent expressions of overt affect and hostility, and instead taking a more subtle, sneaky route to expressing those unmet needs and the frustrations therein. And so it serves kind of as a dilemma for me, is like, so what's the difference between a really overtly passive-aggressive subtype of dependent personality disorder versus a more internalizing version of borderline personality disorder? Anecdotally, I feel like I've met more of the internalizing borderline personality disorder. It just like flows easier and better for me than it is the passive aggressive subtype of dependency. Because I've seen passive aggressiveness with dependency, but I've never seen like a full blown, frequently, kind of incessantly passive aggressive subtype outside of perhaps men, more masculine iterations of dependency. And so maybe, I don't have an answer for anybody listening or watching this, like the difference between the two. It's more just like what's underneath the surface perhaps is a little bit different. With borderline personality disorder, there's far more issues of self and crisis of self, huge feelings of emptiness, even within relationships that just has them all out of sorts. And definitely when self-harm is entering the fray, that's far more common and frequent with borderline personality disorder. Whereas dependency, it's emptiness if the person leaves, but otherwise it's this frequent, recurrent insecurity that is masked through passivity and submissiveness. But with the passive-aggressive subtype, is like they're just, the most they're ever going to do is be passive-aggressive. They're not going to be attacking and hostile. They're not like forming a defense around this like magma core. That's just the way that they operate. Whereas that kind of more internalizing type borderline personality disorder, looping back around, is more like creating, a big wall around the volcano, trying to keep it more contained. That's super subjective, and that's me just speculating. But it's just kind of a curious thing. It's certainly a curious thing because they just feel very similar, very similar. So that is the passive-aggressive subtype. Holy moly, a lot of information on that one, I know. So let's do the counterdependent now. And again, we'll talk also about gender, and we'll talk a little bit about overlapping conditions. So counterdependent, just understand, it's the underlying issues are the same. High levels of dependency needs. They want to be in relationships. They yearn for relationships. And in fact, very frequently, they're good at the front end of relationships. They're really good at chatting people up, associating with folks, drawing them in even to a certain degree. But the minute intimacy comes into the fray, that's where things fall apart. And they become counter-dependent. They start pushing away. And, essentially these are, the stereotypes. These are like the workaholics of the world, or because they have these fears around dependency, they will find themselves getting addicted and dependent on other things in their life, like substances, illicit substances, addictive substances of any kind. Like they find their way to meet this sort of like ceaseless need in a safer milieu than a relationship, because they're afraid of intimacy, and so they operate opposite of that. These folks are often very fast moving. They're just kind of go. They're always focused on these other things, and so intimacy is just this thing that they pick up along the way. And once it's sufficiently enough secured, whether it's through an auxiliary means or through a relationship, they are Zoom, I'm too busy, I've got too much going on, I'll be present with you for a moment, but if you ask me to talk emotionally or about commitment or anything else, I can't do it, I'm not going to do it, off I go. And they're not saying I can't. They will find lots of ways to make excuses around this before they are back on the road. And with that, they very rarely come into treatment unless they are forced by people that they care enough about to stick with, and they're like, look, you need to go in and get treatment, or this relationship is going to be jeopardized. Once again, I would say this is an anecdote, but I would say older is more likely here, because they've started to see the ramifications of how frequently they lose relationships due to their inability to really initiate meaningful intimacy. But, it's certainly within reason, a younger individual can come in for counterdependency concerns. So that's counterdependent. They operate in a way that would make you think they do not care about anybody, which leads me to the differential. The biggest differential here is narcissism, because these can seem like very self-centered people who just don't care about the relationship, and maybe they're, for their own purposes, for their own needs, it's about their gratification. At the end of the day, the defense matrix is not as robust and not as uncaring and unempathetic as the narcissistic defense is. You talk to these folks and you will definitely get a sense that there is some desire to relate to people, like a genuine, authentic desire. You're not digging underneath the surface to find any desire to be intimate. And when you're feeling rejected or not close to them, it's not because they've devalued you. It's just like you're just not on their radar. They're just too busy with something else. And so there's not this, like, I was going to say neglectful, but they are neglectful. There's not like this, again, devaluing. You don't feel necessarily devalued, not like intentionally, maliciously devalued. You might not feel valuable because they just don't invest the energy and effort into the intimacy. But that I think is the big difference. And sometimes this counterdependency can be misconstrued, or not misconstrued, but misunderstood as, and misconstrued by other people as being in a relationship with a narcissist, which is not the case. It is a different type of intervention, in a way, where it's trying to get them to realize their deep dependency needs that they're fleeing from. Whereas narcissism, there's a lot of like cracking through and dealing with this fragility of self that is just waiting for you on the other side to even get them remotely close to, relating to people. I don't know. I mean, people have treated counterdependency far more than I have. I don't think I've ever really directly treated it even. They might beg to differ, but I would bargain counterdependency. It is hard to get them in, but you're working with more underlying assets than with narcissism. True blue narcissism, I think there's a lot to be working through to get them to healthily relate with people. Whereas with counterdependency, you just got to get them in, and slowing down is the hard part. But once you do, I think there's a lot more workable space in there. So that's the narcissism differential there. The last note is about gender again. We talk about like gender socialization. And we'll go ahead and talk about attachment too. There's greater insecure types of anxious attachments on the traditional prototypical and passive aggressive dependent personality. And as you might guess it, on the counterdependent, there's a lot more avoidant, dismissive attachment stuff going on, where they just, again, intimacy is dangerous from an attachment perspective. Like, this is not a need I can get met, or it's too scary to meet it, and so I'm going to do things in the service of actual intimacy. And so they tend to fall along those lines. I do wonder, from a gender perspective, again, a gender socialization perspective, if I don't see a ton of men diagnosed with dependent personality disorder, nor coming in. And I wonder if this is another one of those camps of, like, if you're not seeing them under the dependency framework, where they might be more aggressive or more just willing to share more emotion, and so you don't get the same dependency vibe despite having a lot of self-insecurity and this vacillation between perhaps passivity and aggression. Again, I'm not talking like overt, wild levels of aggression. I'm talking like expression of anger and frustration and those sorts of things. If you get a lot of counterdependency, I went looking around on counterdependency. It's never been diagnostic. You can't diagnose it, and so I think that's limited research. So I don't know if that would hold out if there is research out there about incident rates for men versus women with counterdependency. But my money would be more on men. We talk about older individuals. Younger generation, again, super curious. I get super curious about, like, like I say this in a lot of episodes on gender, as gender socialization switches around, the things that we more traditionally associate with masculinity and things that we associate more with femininity are beginning to kind of blur a little bit more. We still need to do better with masculinity and healthy masculinity, I will note that. But as I think particularly femininity borrows more from masculinity and says, like, aggression and those sorts of things are okay, I wonder if we're going to see more counterdependence, frankly, across genders. There'll be a gender-free construct. Well, nothing is ever gender-free, but it'll be more equitable, and it'll be more commonplace as well. I get really curious about that. So I think that's it. Yeah. So, we went through passive-aggressive aspects of gender, as well as overlap with borderline personality disorder, and then we went through counterdependent, comments on gender, and once again, overlap with personality disorder, in this case, narcissistic personality disorder. So those are the subtypes in brief. Again, at the end of the day, I think I see more the prototypical, if we just expand the definitions of prototypical and the passive aggressivity that can come into it. Passive aggressive is a little bit more rare. Counterdependent is either a little bit more rare, or you don't see them because they don't come in very often. It's actually a pretty frequent problem. But yeah, hopefully that's a hopeful start point for us. And I'll stop rambling in there. As always, I thank you for listening and watching, and